have this evening is we're going to stand, have a prayer, do the pledge, and then have a professional singer who is back there somewhere on the tape going to lead us in the national anthem. And then just sit down and introduce our speaker. So at this point, would you all stand, please? Dear Lord, you're such an awesome God. We know you are our creator, and you laid the foundations for this country. We pray that you will be with all our nation's leaders, both parties, protect them and guide them, and make the decisions that are right for the people and not for the next election. May you sharpen our minds, embolden our spirits. May we be an agent of change, because if we only wait to vote in this election, if that's all we do, we will not be an agent of change. Please bless the speaker tonight. Bless all of us. May we all listen to carefully and put this message of his in our hearts. In Jesus' name, amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
God bless America. To have with us tonight Dr. Tim Moore, who's a cardiovascular surgeon in the Eustis, Leesburg, Tavares area. There's no telling how many lives he managed to save today. And I know we've had the activities fair, and two ladies came up to me and said that he performed open heart surgery on them. Hopefully they're here tonight to give him another thank you. So I'm going to turn it over to him. The only purpose of this is his presentation, Q&A, and then he has some books to sell. He'll tell you more about those. So a big round of applause for Dr. Tim Moore.
Thank you very much for having me here to speak to you tonight. It's definitely a privilege to address you, and I hope that I can provide you with some information about the changes in the upcoming healthcare environment. I don't have a lot of good news for you tonight, but at least meetings, hopefully you'll be able to understand where things might be headed, and that'll give you some idea of where we need to move things and to get things back on track. My name is Tim Moore. I'm a practicing heart surgeon. Work at Leesburg Regional Medical Center. Been there for 9 years and practicing cardiac surgery for 20 years. And have a great deal of experience taking care of Medicare patients. Right now, about 85% of my practice is Medicare. And that really helps form a backdrop for understanding how government-run healthcare is going to move in the future. Before I get started, though, I need a married couple to help me out. I'd like for you to hold on to this $20 for me, please. Just hold that for me for a little while before we get started on the talk. I'll get that back from you in just a minute. All right. First of all, let's deal with the concept of the government running healthcare. And let's think about something else that we see every single day in our regular, ordinary life, where the free market has done a great job. It's produced fabulous technology, huge advances, and the costs have come down, and the availability is there for everybody. And I'm sure most of you have one in your pocket right now, a cell phone. Electronics, we've seen quality of televisions and telephones, radios accelerate enormously in the last several decades, and they're available and they're affordable. Well, what would happen if all of a sudden the government decided to take over the electronics business? So how would the government solve our electronics problem once they decided there was a crisis in the availability of electronics to everybody? Well, beginning in 1964, they would decide every American has the right to consumer electronics, and they would teach us into the schools. So that everybody grew up believing that electronics were a right of every American. And at that time in 1964, they would analyze the cost of providing transistor radios and tube televisions to everybody and concluded that based on the current demographics and usage that this was a very affordable and good long-term solution. So then what's the next thing you do? Once you decide that everybody has the right to electronics, you take the price tags off of everything so that nobody knows how much it costs. The consumer has no idea how much their electronics cost. And with free, so to speak, electronics, and nobody aware of the cost, the demand far outstrips supply, leading to shortages. The program also cost a great deal more than anticipated. Finally, over the next several decades, new electronics emerged, such as flat-screen televisions and personal computers. And these cost far more to make than the original simple electronics. But still, everyone is entitled all they want, and the cost of the program spirals out of control. Well, you solve that problem by putting price controls on, and you make sure that the price controls are below the cost of what it actually is required to manufacture the devices. Now, some people don't take very good care of their electronics. They abuse them and don't look after them like they should, but it doesn't matter. If they break, they're still entitled to immediate and unlimited replacements. The manufacturers who are making these things and being paid below cost for them can no longer sustain themselves with price controls. Availability and quality continue to decline. Now, right in the midst of all this, where things are really going badly, the government steps in and decides that not only are electronics going to be everybody's right, but home appliances will be too. We'll add that into the program. So that further puts an enormous burden on the system. And then, also during these decades, people's life expectancy increases. People are now living 20 years longer, and during that 20 years, they're going to consume a lot more electronics than they ever did before. And finally, when the system completely falls apart, the government must now take over completely and decide who gets what. So that's sort of how things would work if the government took over our electronics, declaring it to be a crisis, declaring it to be a right of every American. That's what happens when you lose sight of the free market. Insurance, on the other hand, is a way to amortize risk among a large group of people by spreading costs out. So typically, insurance is designed to protect people from exposure to relatively uncommon but risky events, such as your house house burned down, a car accident, or something of that sort. But using insurance as a mechanism to purchase things is a terrible way to do that, and it's very, very inefficient. So exactly how do we get to the system that we have today with private insurance and Medicare? Originally, in the old days, patients paid their physicians directly, and in some places where it wasn't necessarily cash, it might be chickens and it might be eggs. But in the private insurance, still got a big problem with feedback. Is there anything we can do about that? Okay. Then eventually, insurance companies came in there to protect people from, again, these very large, catastrophic, expensive events. So you still pay cash to the physician for your routine, regular needs, but you were insured in case there was a bad hospital event or a bad accident or catastrophic illness. However, with World War II and the economy and the difficulties that we saw back in the 40s, there were wage and price controls put on employers in the Roosevelt and Truman administration. And because employers could not offer more in terms of wages, they offered benefits. They offered health insurance. And the government made that tax deductible for the employers to allow them to do that. And that's why today the majority of people using private health insurance get it through their employers. In 1965, the government provided Medicare for those over 65 and Medicaid for the indigent. Medicare is paid from a payroll tax, which originally was 2.9% in total, shared between the employer and the worker. This was capped. There was a limit to how much you could pay up until 1993. Now there's no limit on the amount of income you are subject to with the Medicare tax. And again, after the ACA Affordable Care Act in 2012, it's increased to 3.8% on all your income above $200,000 or $250,000 if you're married. Who gets to get into Medicare? Well, if you're 65 years old and a legal resident of the United States for 5 years, you qualify for Medicare. Or if you're on Social Security disability. So we actually see Medicare patients who are much younger than 65 because they're in Social Security disability. They qualify for Medicare. If you pay into the system for 10 years, you don't have a premium, and there's no means testing for it. So that's sort of the basic background of Medicare. The advantages for Medicare, you get the highest quality health care anywhere in the world, and it's available for anyone who qualifies. The disadvantages are that it doesn't pay the provider very well, and the system is positively, absolutely one broke. Well, for those of you who would like to believe their government, and believe what they tell you, and believe that they have your best interest at heart, and believe that they know best in how to run things, let's look at one of the very first entitlement programs, Social Security. The Social Security Act was signed in August of 1935. At that point, it was set up to sound like a pretty good deal. You only pay 1% of your income up to your first $3,000 income. So your total Social Security liability each year was $30. In return for that $30 a year when you retired, you got $22 a month. Well, that sure makes sense, doesn't it? However, at that time, 1935, when this was enacted, your life expectancy was only 60 years. Money was to be paid into a trust fund, not pay as you go. Half the jobs did not qualify for Social Security. The benefits were not taxable, but here's the important point. In 1940, there were 159 workers for every Social Security retiree. Does anybody have any idea how many workers there are per retiree now? Three. And it's dropped. So it was never designed to be a retirement plan. So fool me once, shame on you. When they started looking at centrally planned health care, one thing is true about any form of centrally planned economic system. They are always inferior to the free market economies in every circumstance in delivering goods and services. When you read a landmark book called The Road to Serfdom by Frederick Hayek, he described this problem. He said that the inevitable problems and outcomes of centrally planned economies were the result of the fact that there is just too much economic knowledge in society for any central group of people or And economic decisions eventually become political decisions. And these eventually become authoritarian. Does it sound familiar? There is no way to accurately set prices under a totalitarian socialistic system. As a matter of fact, in the Soviet Republic, they had a list of 3 million prices they tried to determine for the entire country. It was a disaster. There were shortages in one area, surplus in another, warehouses full of rotting food, and other areas and bread lines in others. It's just not physically possible to manage such a large economic system in central planning. And that doesn't stop the government from trying. And the public wants security. So initially, the public wants some kind of security, even at the cost of liberty for themselves and for others. And as Hayek said, we've already seen that the close interdependence of all economic phenomena makes it difficult to stop planning just where we wish. And once the free working of the market is impeded beyond a certain degree, the planner will be forced to extend his controls until they become all comprehensive. These economic considerations explain why it is impossible to stop deliberate control just where we wish. Once you get started down this pathway, things become chaotic. When things become chaotic, people demand more solutions, and that results in more economic control until eventually there is a complete takeover, an economic dictatorship. Nobody recognizes the Austrian economist put it this way: this time is different are the 4 most expensive words in the English language. Medicare is going broke. Medicare is going broke. There's no question about that. We started paying out more in Medicare in 2008 than we took in, and the trust fund is going to be exhausted in 2024. That's with the Medicare 2013 Trustees Report, and that's 5 years sooner than they were predicting a couple of years ago. Medicare is running out of money. The 2013 Medicare Trustees Report, you can go and research this yourself online, is filled out by accountants and actuaries who must sign their name to the bottom of it. And they know that what they're putting out is not accurate. They're putting out what they are told to based on the numbers that the government tells them they must use. But since they're signing their name to this, they don't feel very comfortable with it. So for the last several years, they put out an alternative scenario that's also available online. And you can go and read that. And in the alternative scenario, they say, listen, we put out the trustees report, but don't believe a word of it. This is what we really think is going to happen. And in this talk, I try to use as much as possible the government's own data and numbers that you can easily research and get yourself. And there are references at the end of the talk if you want. As Winston Churchill put it, the main qualification for political office is the ability to foretell what is going to happen tomorrow, next week, next month, and next year, and have the ability to explain afterwards why it did not happen. So, Medicare is going broke. So why? Well, I can tell you why. There's a very, very key reason that health care costs a lot. It's because it's expensive. We have far more advanced health care now than we did 40 years ago. We've got kidney transplants and liver transplants and brain transplants and dialysis, and everything is now available at the highest level of technology. And one of the things is, if you wanted to go back to 1970s prices for healthcare, you'd have to go back to 1970s technology. Or to carry it back even further, you could go back to the early days of healthcare where really the only expenses would be leeches. Another reason that Medicare is going broke is because more people are living longer and they're consuming more healthcare. The system is a victim of its own success. Because our healthcare has been so good and has extended the lives of so many people, they are consuming more health care. In 1901, the average life expectancy was 49 and a half years. In 1940, that life expectancy was up to 65 years. When we said when Social Security was first enacted, it was around 60 years. In 1965, when Medicare was passed, the average life expectancy was 70 years. So it was expected that you would go on Medicare, and within 5 years, you wouldn't be around any longer. However, now, the average life expectancy is 78 years. But if you manage to make it to 65, and you haven't died of a car accident or a gunshot wound or something of that sort, if you make it to 65, your life expectancy is now 83 years. By extending life expectancy, we've created an entire class of people who have decades to develop health problems which will need to be out their lung cancer. 3 years later, they come back from bypass surgery. 4 years later, they're getting an artificial hip. And so that's just the reality of the success of extending people's life. There's a lot more health care that's being consumed. Fool me twice, okay? Let's look at the second time the government decided to step in and essentially plan an entitlement. Fool me twice with Medicare. Let's look at what they were predicting for us when they enacted this. Just like Social Security, Medicare was passed into effect on July 30th, 1965. It was originally designed to assist the elderly with rising health care expenses. It was based on fee-for-service and balanced billing was allowed. Here were the cost projections. The premiums were only going to be $3 a month, and Medicare would require appropriations of about $500 million a year at that time from the general tax revenues. Well, they knew it wasn't going to stay static. They knew that the cost of the program would grow over the time. So what did they predict? When they passed the law in 1965, our government experts who were so good at essentially planning our health care estimated the cost of the program in 1990 would be $9 billion. Well, in fact, by 1990, the actual cost was $110 billion, over 10 times what they projected. The cost in 2012, last year, was 5 times that, $555 billion. And on top of that, you can throw in another $251 billion from Medicaid. And what do we expect the cost to be in 2020? $932 billion. So these people that are setting up these entitlement programs really have no clue as to how these things are going to evolve over the decades to come. Who is going to pay for Medicare? Well, this is what's expected to happen in terms of the increased number of beneficiaries and the number of workers. We talked about how with Social Security there were 149 workers for every beneficiary. Well, the worker-to-beneficiary ratio is expected to decline in Medicare from 3.7 to 2.4. There's not going to be enough people paying into the system to sustain it for the people that are taking it out. And I know there are a lot of criticisms about this, and people are angry about it, and they're frustrated about it, and they want to know why they can't expect Medicare to continue as it always has. It's very difficult to accept some of these realities, and people get quite angry and frustrated about it. And they say, well, surely if I paid into Medicare, I'm entitled to get my health care back out of it, right? Yeah, can I have my money, please?
No.
That's $100 ago.
No,
No, I need $100.
sorry.
Yeah, I
You
can't have
can
my,
have your $20.
well, I want 100.
I don't have it.
Okay, well, let's look at what we're talking about with Medicare. If you take an average wage earner married to a low wage earner, they will take out of Medicare 5 times what they paid into it. People are consuming a lot of very expensive health care, far more than they ever paid into the system. They will take 5 times the money out of Medicare than they paid into it. Even if you're a high wage earner married to an average wage earner and you're paying a lot more Medicare taxes, as a couple you will still take out 3 times the amount of money. See if I can get this corner. 3 times the amount of money out of Medicare that you paid into it. But most people, most couples will be taking out 5 times as much as they paid into it. Well, certainly our country can afford to take care of its elderly, right? I mean, that's a societal responsibility. Our country should just buck up, and we can afford that. We can take care of our elderly, right? Well, here's the latest budget. And you can see that the entitlement program is the largest single expense up here is the Center for Medicare and Medicaid Services. And then just below that is Social Security. This has been an enormous flip-flop over the last many decades. As you go back into the post-World War II years, obviously the defense budget was by far the largest portion of our federal expenditures. But now, this is the Center for Medicare and Medicaid Services. It is dwarfing all the other expenses for our government. Well, we just put price controls on, right? Let me tell you something. There's a great way that you can save money on your home mortgage. It's one of those weird tricks you hear about. If you want to reduce your home mortgage by 50%, all you need to do is every time your mortgage is due each month, just send them a check for half. Just send them a check for half. If you do that. Okay, well, it's the same concept. People don't realize that you can reduce the price of something, but that does not lower the cost. And there is a cost And price controls in economics always has three outcomes when it's carried to its extreme. There are shortages, the quality declines, and then eventually there are black markets. And if you want to see this in its extreme, you can go over and look at the socialized healthcare systems in Eastern Europe, where basically to get on the list, you have to pay your certain bribe. You have to pay a little money under the table. It sort of becomes a black market type economy. We've already seen over and over and over again the declining quality of healthcare in the National Healthcare Service in England, which is actually your pride and joy. The stories that are coming out of there, the cancer survival rates, all the quality over there is deteriorating tremendously. And that is where we're headed. Price controls have been tried for 4,000 years. There's a great book about 40 centuries away from price controls that details in all the instances that the same outcomes have occurred. With price controls, they simply don't work. And I don't have time to go through each and every one of these. This is enough for a lecture all by itself. I know that many of us are interested in our heritage in this country. Pennsylvania, 1777 to 8, and Washington's and Valley Forge. The winter was cold, but the starvation was real. And what had happened was that the Continental Army could not afford to pay its soldiers. They were out of money. So what did they do? They printed money. They inflated the money supply. And when that happened, the farmers started charging more and more for their crops. And so now the crops are unaffordable. So the government comes in and puts price controls on the farmers and their crops. Well, when that happens, price controls, the first thing that happens is shortages. So the farmers would actually sell their money to sell their agriculture and crops to the British, who would pay them a fair price. And that's why they wouldn't sell to the Continental Army. And that's what led to the shortage of food in Valley Forge. Now we could go on and on about the bad results of price controls. And as Milton Friedman, the other famous economist out of the Chicago School of Austrian Heritage, said, ever succumb to collectivism, to government control over every facet of our lives, it will not be because the socialists made the arguments, it was through the indirect route of wage and price control. Well, certainly we'll just cut money from the hospitals and doctors. They're floating in cash. They've got plenty of money, right? There's no reason we can't just cut that amount. There's all this fraud, abuse, waste, and they just need to tighten their belts and trim their budgets. We'll just cut payments to the hospitals and doctors. Well, when you look at the cost of taking care of Medicare patients, overall, Medicare only covers about 90% of the cost of taking care of Medicare patients. Now, there are certain specialties where Medicare is a moneymaker for the hospital. Cardiac surgery, my own specialty, makes money for the hospital. Orthopedics does. But when you look at all the Medicare patients that a hospital takes care of, on the whole, Medicare gives the hospitals about 90% of what it costs to care for them. And you can see this steady downward trend. Now, whether there was a short bump up in 2010, the rest of the trend is down and down and down and down. And so if it's 90% of what it costs to care for Medicare patients now, the government estimates that, and this is the government's own estimates, okay, the Medicare Trustees Report, it's estimated this reimbursement is going to be 15% negative by 2019, 25% negative by 2030, and 40% negative by 2050. And this is where we're headed. Well, doctors make plenty of money, right? I mean, we should just cut their fees. It's just like when they drive around fancy cars and all that sort of stuff, we just cut their money, right? Well, this is what we're dealing with. This is what has happened with what it costs for us to run a practice, and this is what's happened with our Medicare payments. And I can tell you, when you adjust these numbers for inflation, for my own specialty, our fees have been cut 82% over the last 20 years when you adjust them for inflation. It's very hard for us to sustain a practice with those kinds of cuts. Currently, when you use private insurance as a comparison for Medicare, Medicare reimburses at about 80% of what private insurance pays. But the government estimates that in 20 years, it's going to be 40% of what private insurance pays. And one of the reasons the Medicare Trustees Report states that their actuarial analysis in the Trustees Report is not accurate is because physicians are slated to get a 29% cut. And they know that if they do that, we just can't stay in practice, can't take care of Medicare patients any longer. So they the American public has been fooled the third time with Obamacare. The American Care Act was signed, the Affordable Care Act was signed into law on March 23rd, 2010. Let's look at what's going to happen with this. The law has incentives and penalties. That's the whole structure of Obamacare. It has incentives to make insurance more affordable if you want it, for some people, and it has penalties to make you get it if you don't want it. I'm going to break this down. The incentives for the state, okay? If you expand Medicaid, then you will get more government money for your Medicaid program. Medicaid is a shared expense between the states and the federal government. The states run their own individual Medicaid programs. Each state has sometimes a different name for their own Medicaid program, but they share the expense with the federal government. So the government said, if you expand your Medicaid program, we'll give you some more money, at least early on in the first few years. There's no guarantee what the long-term support is going to be for that. However, the Supreme Court decision said that they could not force the states to do this. And we'll talk about the result of that in a minute. Penalties for business. If you have 50 employees, you must give them insurance or pay $2,000 in a penalty for each one. That's why you've heard so many of the businesses are not hiring. They don't want to cross that 50 employee threshold. Subsidies for individuals. Well, if you make less than 14 at the poverty level, you're eligible for a tax credit or a subsidy to help you go out and buy insurance on these exchanges. And when the act was put into place, it was estimated that the average subsidy would be about $4,000 per person, $3,970 per person. But they would also penalize you. And the penalty was $95 in the first year, and it was going to steadily go up, or 1% of your taxable income, whichever is greater. So that was the whole idea. We'll give a carrot to the states to get them to expand their Medicaid program. We'll penalize the businesses if they don't offer health care to over 50 employees. And we'll penalize individuals if they don't go out there and buy it. But we'll also give low-income individuals money to help them buy health insurance. Well, a key point here that you need to remember, because we're going to talk about this a little bit later, is that as the law is written, as it is written, only the states that set up state exchanges have subsidies and penalties. The states could not be forced to set up their own exchange. They could do so if they wanted to. And if the state set up an exchange, then the subsidies and penalties that we talked about on the last slide apply. If the state did not set up an exchange, then the federal government would set up an exchange for your state. And as the law is written, if it was a state where the federal government set up the exchange, the law is very clear. No subsidies, no penalties. Remember that thought. We'll come back to that. How many of the states thought setting up exchanges was a great idea? 14. So in 36 of the states, exchanges are run by the federal government. Remember, the law says if it's a federal exchange, no subsidies, no penalties. Obamacare, promise number one. Obamacare will reduce the deficit, as he said. But it is a cost that will not, I repeat, will not add to our deficits. I set down a rule for my staff and my team, and I've said this to Congress. Health care reform must be and will be deficit neutral in the next decade. How does that promise work out? The original cost of Obamacare was supposed to be $949 billion. In February this year, 8 months before it came out, the new cost was $1,900 billion. Almost double. The subsidies that we talked about that were in the $3,000 range, well, they're actually going to be in the $5,500 range. Now, they're going to offset some of this extra cost, this extra $1 trillion cost here, by $200 billion penalties on the uninsured and employers. But we just know that this year they delayed the employer penalty by 1 year. And $150 billion is supposedly offset by taxes on high-premium insurance plans. So if you got these Cadillac plans, these high super-duper plans, there's going to be an extra tax on them. And then $200 billion offset by new taxes. And we'll talk a little bit about that later. What else do they promise? Medicare will be protected. You heard that, right? Medicare is going to protect you. Obamacare is going to protect Medicare. Why? It's Paul Ryan and the Republicans who want to push grandma off the cliff, right? Well, they're going to cut $716 billion from Medicare. At least $150 billion of this is going to be from Medicare Advantage. And already Medicare Advantage patients around the country are getting their cancellation letters. And they are also cutting doctors out of the Medicare Advantage program. So not only are patients being dropped from it, physicians are being dropped from it. So, when it said you can keep your doctor, that's not true. A lot of doctors are being dropped from Medicare Advantage plans as Medicare Advantage, the running this, are trying to cut their costs. And this is what's going to happen as they take that $716 billion out of Medicare. And you can see that this is for the hospitals. Here's what Medicare compared to private health insurance. This is what's going to happen to Medicare over the next many years. And Medicaid for the hospitals is on the same downtrend. What about physicians? Medicaid's going to stay the same for physicians, at least as they put it. But here comes the Medicare payments for physicians. So one of the questions that I think people have asked is, what's going to happen to my Medicare? Are my premiums going to go up? Or my copays going to go up? Probably not. What they're going to, money is not going to be taken from the Medicare patients. Money is going to be cut from the hospitals and the doctors. Also, they are trying to shift patients into Medicaid. Now remember how we talked about how Medicare does not cover the cost of taking care of Medicare patients? We said that Medicare only covers about 90% of what it costs to care for Medicare patients. Medicaid is so much unbelievably worse in terms of paying the hospitals and doctors. Nobody can take care of Medicaid patients and not lose a ton of money on them. In many states, Medicaid is the largest item on the state budget. And only 20 states have agreed to Medicaid expansion. Remember we said that that was one of the carrots, that if you expand Medicaid, we'll give you extra money to help run your program. Only 20 states took them at their word. And of those states, of the people who have successfully signed up for a plan, 85 to 90% have actually signed up for Medicaid. Let me explain that to you. When the government puts out statistics and said all these people are successfully signing up for health care under Obamacare, you need to go and look, and you can research this. And it turns out that all the success the government is claiming about people that are signing up for health care under Obamacare, 85 to 90% of them have signed up for Medicaid. Your government is being very dishonest with you. They're telling you that these people are successfully signing up on the exchanges for health care, but they're signing up for one exchange for more Medicaid. And when you look at how bad Medicaid is for the state of Florida, remember we said that Medicare only covered 90% of the cost of what it costs to take care of a Medicare patient. In the yellow states, Medicaid pays 70% of Medicare. And so you see Florida here is one of these yellow states. Medicaid is a terrible problem for providers in the state of Florida. Well, what about this promise? We've all heard about this one lately, right? If you like your health care plan, you'll be able to keep your health plan, period. If you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance. This law will only make it more secure and more affordable. And we've been hearing about that for the last 7 weeks since it's rolled out, right? We knew in advance that this was not true. The government knew in advance it was not true. When Obama spoke those words, he knew they were not true. Okay? We knew that, first of all, the employers were going to react to this by dropping employer-provided coverage. And you don't hear as much about that right now today as you hear about the individual market with people that don't have employer-provided coverage. But employers have dropped coverage, they have cut back, and they have dropped family members off. We'll talk about that in just a second. The Congressional Budget Office estimated that up to 8 million people that were covered by their employer would lose their coverage. But when you look at the individual market, where people are buying insurance themselves, when it's not provided by the employer, these people are getting their insurance policies canceled by the hundreds of thousands, and it will be in the millions. And we're looking now at 600,000, probably closer to 800,000 in New Jersey, 500,000 in California, 300,000 in Florida. There's far more people that have lost their health care insurance than have actually managed to sign up for a plan on the Obama exchange. Children are using coverage. Number one, the IRS ruled in January that employers don't have to cover the whole family. And we said there was a $2,000 penalty if you had over 50 employees and you didn't provide health insurance. Well, they said, okay, fine. But the IRS says we don't have to cover your family. All we got to do is cover you. And that's why we see many, many large corporations that are dropping family coverage. So the children are getting dropped out of this. But also they've made it so unfavorable for the insurers that it's almost impossible now to get a child-only policy. Say you don't cover for you or your spouse, but you get something for your kid. Insurers have made this almost impossible to get. And that's largely due to these pre-existing condition requirements. And now there are 20 states out of 50 that don't have any insurer in that state that will provide a child-only policy. Seniors will lose coverage if physicians refuse to take Medicare patients due to reimbursement cuts. And right now, as it stands, 1 in 3 doctors won't take Medicaid. That's only going to skyrocket as the reimbursements continue to fall. I need to tell you about this because a lot of people don't know about this. Say you think Medicare is such a crummy deal, and you know it's going nowhere, and your doctor's getting dropped out of the Medicare Advantage, and you don't think you're going to get good care with Medicare in the years to come. You can't get out of it. You're stuck. Just like your doctor, you're stuck. And I'll tell you, there's 2 reasons for this. Number one, if you come to me and you say, Dr. Moore, I really like your services, and I know you don't like Medicare, but I'm willing to pay you out of my own pocket or finance with my family contributing, and I agree to take care of you outside of Medicare, 2 things happen. One, Medicare will not pay you for your health care for that particular procedure. And number 2, as a physician, I am banned for 2 years from taking care of any other Medicare patients. But this is what's really shocking. If you opt out of Medicare completely, you lose your Social Security benefits. And not only that, but you can't pay any Social Security benefits back that you've already got. And that's from a 2011 court ruling in a lawsuit, Hall versus Civilians. So if you're a Medicare age, you're stuck. Well, they also promised that insurance would be more affordable. As our dear leader said, I have made a solemn pledge that I will sign a universal health care bill into law by the end of my first term as president that will cover every American and cut the cost of a typical family's premiums by up to $2,500 a year. Right? All those other promises held up. By 2013, our leader of Medicare, our Health and Human Services, Catherine Sebelius, Secretary, said these folks will be moving into a really fully insured product for the first time. And so there may be a higher cost associated with getting into that market. She was acknowledging that all of a sudden you're going to be moving into higher quality care than you originally planned. It might cost you a little bit more. And then finally, the administration finally said the message that consumers will be able to get health insurance that will fit their budgets is highly motivational, but not believable. Straight out of the Obama administration. The Society of Actuaries predicts that insurance policies are going to increase by an average of 32%. That's an average. When you look at the studies that were done by the states, looking at what was going to happen in each individual state, Wisconsin, Minnesota, Colorado, increases of 19 to 30%. Ohio, 55 to 85%. Maine, Oregon, and Nevada, similar increases. California, at least 20% higher. We've already seen premiums for health insurance go $3,000 or even more. And not only are they raising the cost of the premiums, they're raising your deductible. Well, why is this? What is Obamacare doing is making health care insurance unaffordable. They should name this the Unaffordable Care Act. What is Obamacare doing that's causing the premiums to go up so bad? Well, the first are the mandates. They're telling the insurance companies now they must provide all these services that were not originally part of insurance. In other words, you're now going to get in a plan that's going to cover all these things that you don't want. I can guarantee you, I'm 54 years old. I I don't need a maternity plan. I'm past childbearing age. But I'm going to have to pay for maternity care, and I may not have the best figure in the world, but I don't intend on getting breast implants anytime soon. And that all goes into these things that are mandated coverage. They are telling the insurers that they must cover, so that's why the premiums have gone up. And I want you to think about this for just a second. If you're selling healthcare insurance out there, and there are mandates in there that you're making people pay, and you as a consumer are paying for services that you're never going to use, never going to need, that's basically a tax. You basically are being forced to pay into a system of redistribution that is going to redistribute benefits to somebody else. So in its own way, the insurance policy is like its own little socialist program, because it's redistributing people, money from people who are being forced to pay for services that they're never going to need, such as paying for Sandy Fluke's birth control. Guaranteed issuance. Well, we've all heard about this, right? That's not insurance. It's not insurance if you can go get it anytime you want it. It's not insurance if you can go buy it after fire insurance after your house is already burned down. And that's what's going to happen, is that people know that they don't have to buy insurance until they get sick. And so because of that, that means the insurance companies have to account for that, and that causes the premiums to go up. Community rating, this means that you can't charge higher risk, older, sicker people more than healthier younger people. There's a cap, there's a limit. You can only charge your oldest and sickest and unhealthiest people 3 times the lowest rate you charge anybody. So they have to raise the premiums for everybody. The medical loss ratio rebates, they basically have established a law that says that the insurance company has to spend a maximum of 20% on administrative costs. At least 80% of the premium money coming in must be spent on health care. So the way to get more administrative costs covered is to raise the rates for the whole thing. Finally, adverse selection, and this is what's going to really, really be crucial over the next year. Obamacare only works if young, healthy people sign up. And there's no incentive for them to do that whatsoever. There's a $95 penalty they can pay, and there's no reason that you would not pay $95 and then just wait until you got sick to get your health insurance, as opposed to spend thousands and thousands of dollars. This is really the Achilles heel of the program right now, and nobody is just rushing out there to sign up as a young, healthy person to help support the whole system. And Obamacare also promised us that no one making less than $250,000 would see their taxes go up. As he said, I can make a firm pledge. Let me see what this firm pledge has been worth. Under my plan, no family making less than $250,000 a year will see any form of tax increase, not your income tax, not your payroll tax, not your capital gains taxes, not any of your taxes. This is a list of the Obamacare taxes. And you can see that there's quite a number of ways that people are going to get taxed. One of the things that really has been interesting is that we're going to tax medical device companies. You may be hearing about that. There's been some push to try to hold that off for a while. These are the companies that make the products that we put into patients, the pacemakers, the artificial heart valves. They're going to tax those companies. And those companies are responding by charging the hospitals more, and they're laying off thousands and thousands of employees. But believe it or not, when you go to the veterinarian, all those little devices your pet gets, little intravenous lines and all that sort of stuff, they're really subject to the same tax. So really, you get more ways than you can imagine. But looking at the whole program, the individual mandate is a tax, right? That's what John Roberts said in the Supreme Court decision. So the individual mandate is a tax, the employer penalty is a tax. I mean, not all small business owners make more than $250,000 a year. And a lot of them are now going to be hit with this penalty if they don't provide health care insurance. They've cut the size of the health savings account contributions. You can only now put in $2,500 a year into your HSA. That is eliminating a tax benefit, which is the same as a tax hike. And if you're deducting your medical expenses, they've cut that from 10% down to 7.5%. Overall, we've seen an enormous adverse hiring, we've seen employers switch employees over to part-time jobs, and physicians are just giving up. Physicians are taking early retirement, they're finding some way to get out, and young people coming behind are not interested in going into medicine as a career. They're certainly not interested in going into primary care. They don't want to go to medical school and come out hundreds of thousands of dollars in debt. And I can also tell you, as we said, price control results in shortages, they result in poor quality. The quality of the people that are going into our training now is diminishing. Right now, of the residents that are coming out in general surgery, a third of them have to go back and do remedial training. We just aren't seeing the same quality person go into medicine as a livelihood that we used to see 20 years ago. This is a slide that I stole from somebody, and I guess there's another thief here because somebody else has stolen it over here, which is a new Obamacare organizational chart. And this is what is really, really key. The person at the center of this that controls this and pulls all the strings is the Secretary of Health and Human Services. Here's your physician down here. Here's your patient down here. And all this is your government bureaucracy. But this is the most frightening part. The Secretary of Health and Human Services. And what's really, really, really frightening about Obamacare is not the economic side. It's not the penalties and the mandates. It's not the canceling insurance policies. It's not the tax hikes. It's not the effects on the economy with not hiring and with people going to part-time work. The frightening part of Obamacare is that we are now seeing regulation without representation. Obamacare had brought under the executive branch of government those functions that are to be left to the states and to our elected officials in Congress and in the Senate. What do I mean by that? The IRS has started making rulings on Obamacare that are outside the legislation as it is written. Example, when we said that employers now don't have to cover families, that was an IRS ruling. You remember quite a while back I said that the law stated that in a state that did not have a state exchange, a state that only had a federal exchange, which was 36 out of 50, there were no subsidies and no penalties. Remember me saying that? Okay. The IRS said no. The IRS said that in states that do not have state exchanges but only federal ones, that all of the above applies. That is not in the law. They said that in states that have federal exchanges, there will be subsidies and there will be penalties, and there will be the employer penalty and the employee penalty. That is a decision, a ruling made by the IRS. It is not in the legislation. And certainly, by far, the most fearsome part of this is the Independent Payment Advisory Board. Some of you may have heard this called a death panel. But let's talk about this just a bit. Historically, Medicare payments to hospitals and providers were worked through with the Medicare and Medicaid services in Congress. They set up the reimbursement formulas. They set up the DRG formulas to determine how hospitals are going to be paid, and they set up the codes for how physicians are going to be paid. This was a negotiating process that went on year after year after year. The Independent Payment Advisory Board is a presidentially appointed panel whose mission is to reduce Medicare costs. And by that I mean Medicare payments. And they are charged with reducing the amount of money that's spent on Medicare. Not your elected officials, but this presidentially appointed group of people whose job is to reduce Medicare payments. So they will come out with payment schedules. And then Congress has a window of time where they can introduce an alternative if they don't like that. But if Congress does not come up with an alternative, then what is issued by the iPad becomes law. So what you've now seen is that the legislative branch has been forced to abdicate its responsibility for making Medicare law to the executive branch, this presidentially appointed Independent Payment Advisory Board. And as we look forward, and we talk about all these things, there are a few legal challenges going out. There's three major routes that people are taking to legally challenge Obamacare at this point. One, of course, that you've heard about is the mandate on contraception, the morning after pill being forced to provide those to ways, and there have been some losses there, there have been some victories there. Unfortunately, even if they get that done, that's only really going to affect a small part of Obamacare. It's not going to affect Obamacare as a whole. The second challenge is that this whole process was a totally jury-rigged legislative event. They got this through and ran it through Congress. The Constitution says all spending bills, all tax bills must come and originate out of the House. And what they did is they took a bill that had to do with veterans housing, the number on that bill, the title on that bill, the body of that bill, and they sent it to the Senate and they stripped everything out of it except the number. They changed the title of it, they changed the body of it, and the Senate created Obamacare and stuck it into this House bill with the House bill number. And there are people that are challenging that from a legal standpoint, saying that's not constitutional. They pulled this kind of stuff before, though, that got away with it. So I don't know that the legal challenge on that is going to really work. I'm concerned about that. The third major legal challenge, though, has to do with what we were just talking about with the IRS ruling saying that states with federal exchanges get to do the subsidies and get to do the penalties. Because that is not part of the law. If you go look at the law, there's nothing in there that says a state with a federal-run exchange can do subsidies and penalties. And if only 14 states have state exchanges and the other 36 don't, if that gets its way through the court system, that may really hold some hope for bringing this to a stop. And that legal avenue appears to have the strongest chance of defeating this. As Elmer Peterson said, some people have mistakenly attributed this to the Tocqueville bill in a different version. But he said a democracy cannot exist as a permanent form of government. It can only exist until the voters discover they can vote themselves large yes from the public treasury. James Barnes said, democracy is two wolves and a sheep voting on what to have for dinner. Frederick von Hayek, the Austrian economist we talked about, said, it would scarcely be an exaggeration to say that the greatest danger to liberty today comes from the men who are most needed and most powerful in modern government, namely the efficient expert administrators exclusively concerned with what they regard as the public good. As Ludwig von Mises, the other Austrian economist, said, government cannot make a man richer, but it can make him poorer. P.J. O'Rourke said, if you think health care is expensive now, wait until you see how much it costs when it's free. And our most brilliant intellectual thinker today, Thomas Sowell, said in his book, The Vision Anointed, what is intellectually interesting about visions are their assumptions and their reasoning, but what is socially crucial is the extent to which these visions are resistant to evidence. Characteristic patterns have developed among the anointed for dealing with the repeated failures of their policies based on their vision. Finally, there is the phenomenon of honor prophets among the anointed who continue to be honored as their predictions fail by vast margins, time and again. And really, the crux of this is who gets to decide. We've already shown that Medicare is insolvent. Medicare is going broke. It's not sustainable. We've added the worst possible solution to it by putting Obamacare on the list. I hate to break the news to you, but there's not enough money for everybody to get everything in health care that they would like. It's just simply not possible. And we can go to a free market solution where the consumer gets to decide what they're willing to spend, what they can afford, what type of health care policy they would like, how much their family can afford to support them. And the only other alternative is to have the government decide for you. Have the government make those decisions for you. And that's what's going to happen. The government take over health care. Just as we've seen that the executive branch has taken over the functions of the legislative branch, we will see that the administrators will be deciding your level of health care, what you get. Who gets to decide for whom? Thank you very much. I would also mention to you that since you guys are going to be suffering under the new health care regimen, I have a book that came out this year called Surviving the Suffering. It's based on my 20 years of practice as a Christian heart surgeon and looks at the different types of suffering that we encounter from a biblical standpoint, realizing that there are many, many different kinds of suffering that we must diagnose which type of suffering we are undergoing so that we know how best to treat it. so much for your time and your attention.
Do you want a little bit about healthcare? I'm sure you did. What we're gonna do now, have a Q&A. We're gonna bounce back and forth. And I'll let the doctor select the person that's gonna speak, and the microphone will go to that person.
Dr. Moore, will the situation be any different for both the healthcare provider and the individual, for those that have, in addition to Medicare, a supplemental plan, as it's often referred to? So those that have private insurance as a supplement, those that have TRICARE, for example, as a supplement. Will things be different on either end or both?
I think that it would be different for the individual because they're going to have less out-of-pocket expenses. It will not be different for the provider. I mean, our fees are set in stone, and we're not allowed to negotiate. Is the microphone? Sorry.
Can't hear you.
We can't hear you.
Okay, is it any better now? Better? Okay. It will probably be better for the individual because they will have fewer co-pays and less out-of-pocket expenses. It will be no different for the provider because our fees are set in stone. They're not open to negotiation. We can't balance bill, like we used to in the future, where we would set a fee, and if you could, Medicare only paid a certain amount, we could send you a bill for the rest. Those days are long, long gone. It won't affect the provider.
Okay, question on this side.
How would you stop Obamacare?
The question was, how would you stop Obamacare? I'm somewhat pessimistic about that. I think that the strongest legal challenge, the one that has the most legs to it, is the one that goes, has made its way up the court system about the IRS falsely claiming that states that have federal exchanges can do subsidies and penalties. And so far, it looks like it's making its way up. I know that the Liberty Council, which my wife is affiliated with, the Women in Fact Nation, has a lawsuit out in the face attacking every single aspect of the law. The employer mandate, the contraceptive bill, the fact that the bill was a shell bill, traded back and forth between the House and the Senate. I'm really not sure how those have legs. I mean, if this court decision about the mandates doesn't go through, we're pretty much stuck with this, at least, until 2017, because we're going to have the majority of people in the Senate, majority of people in the House, and a different president in this overturn. There's been a great deal of hoopla lately about the failures of the website and the technical aspects of that. As miserable as that whole system has been, I do think that's ultimately a solvable problem.
Can't hear you.
I think that is ultimately a solvable problem. They will be able to solve the technical aspects of the website enrollment issues. The thing will likely, as it plays out, melt down. I mean, the system is designed for young, healthy people to pay into the system to support the older, sicker people. I mean, if you think about it, it's a horrible deal for the younger people who voted for this type of policy. It's a huge transfer of wealth from that generation to the older generation. I think, in my pessimistic sense, that that was the whole plan all along, was for this thing to fall apart. I think what's caught the administration by surprise is that it's falling apart a lot quicker than they expected. And with public outrage on this, as it does deteriorate, fall apart, there may be some room for us to change things in the next election.
Use the microphone, please.
I just wonder if technology can cause
somewhat unique compared to other countries. We've always had a fierce sense of independence and self-control. Other countries seem to be quite happy with having the government run their lives and in many aspects of their market system. And on the other hand, there are a lot of people that are quite content with this. There are a lot of people that are happy with this. And in other words, I don't necessarily see that Barack Obama is the problem. The problem is that this country put somebody like Barack Obama in office 2 consecutive elections. And you know, his favorability rating, his approval rating has dropped to 40%. My gosh, that means there's 40% of Americans out there still think he's doing a good job. I mean, I can't believe it. I can't believe 40% of people think that he's still doing a good job. All this come out about these. So there's a substantial portion of Americans, once this system gets in place, will be quite content with it. And it's on the shoulders of those who stand for liberty, for economic freedom, for free markets, they're going to have to stand up and
But the opportunity.
Okay, another question.
Oh, sorry.
You don't have a mic inside. Anybody on that side, is that side's turn? Go ahead.
This is the second question.
Oh, did somebody?
I'll yield to somebody else first.
Okay, nobody on that side.
Well, you kind of answered the question I had. This thing, I believe, was planned way back with the czars, and it was all set up that this was going to happen. Now, the thing that hasn't happened is the young people are still not seeing any of this. Like our kids are young, we have an actuary son. They don't see any of these problems. And I don't know what it's going to take before they open up their eyes and realize that they need to wake up, because things are going to change and they need to stop this thing by their voting and get informed. Now,
Any question?
so my question is, how do you reach these young people that love this man so much? They think he's the coolest thing there is.
I think you're absolutely right. They are very enamored of him, and you said they don't see the impact. They're getting to stay on their parents' policy till they're 26 years of age, and it's only when they get out and start earning money and trying to make a living and start realizing that the opportunities that are there for them are not the same as available for their parents, or there for us.
But they're already making all kinds of
No
money.
mic, no questions.
A lot, I think you're absolutely right. The youth are very difficult to reach in this. They don't see the impact. And even the ones that are out of the house that are working, I mean, if you take a look at, what is it? They're looking at a $95 penalty versus thousands of dollars of health insurance that they don't need. And if they do need it, they can go get it after they're already sick. So there is very little incentive for the youth to join up to this. And that is going to ultimately hurt the program. Because if those people don't get involved, they don't support it. You know, my philosophy about this has been recently that is to stand back and get out of the way of this thing and just let it go. Let it go full force. Don't try to stop it. Let it hit all the bad outcomes that are coming. We've already seen, the people that are getting their policies canceled, and just let it go. And I think that may stir up enough public outrage that things can turn around for the next several elections.
Doctor, your presentation to us has made it readily apparent that there is adverse impact, considerable adverse impact to the healthcare provider community, doctors, facilities, and whatnot. What do you see as the major adverse impact to the retirees who have Medicare and may or may not have a supplement? What's the major adverse impact you see to us?
Well, I think for the people that are on Medicare, what you have to be looking for in the future are the things that we talked about as a result of price controls. Eventually, there will be shortages. They are not going to have enough money to keep Medicare funded at the same rate they have. And with Obamacare, they're pulling more billions of dollars out of this. The money to hospitals, money? Time's up, battery? Yes, sir. The money is simply not going to be there for the providers and for the hospitals. And that's going to, and as the money goes down in Medicare for providers, there are going to be fewer and fewer people that are going to stay in healthcare. And it's going to result in shortages. It's going to be far more difficult for people to find a doctor. There's going to be increased waits to get doctors. And we're going to see that physicians and hospitals come together and partner. Already half the physicians have gotten out of private practice now working for hospitals. And you're going to see far, far more physicians go to work for hospitals. We know that when physicians go to work for hospitals, their productivity drops by about 25%. They're going to see fewer and fewer patients, they're going to perform less and less operations. It's going to be more and more of a struggle for those that are retired on Medicare to get that same level of health care in the same time and fashion that they get it now. And from the government standpoint, delaying things, putting people on a waiting list as they have in other countries, is a form of ration. In other words, if you put people out long enough, a lot of people will drop out waiting for health care.
An extension of what you're talking about is once the hospitals and the doctors come together and work together, the government will give it and hire these people and take ownership in it. In other words, they become the employer, the physician, and the hospital. My question is, can you discuss a little bit about right of conscience? Right of conscience. The fact that we have the right not to do certain procedures that we think are immoral as physicians versus practitioners.
Well, I think that
Doctor, we didn't hear the question. Could you repeat it, please?
Okay, I was talking about the extension of this, if the government really wants to do it, could push this into the point where physicians and hospitals are really an extension of the government. Much like the Church of Germany was an extension of the government there. And the pastors didn't do anything because they were being paid by the government. And I'm talking about right of conscience. Euthanasia, abortion, things that physicians and nurses and practitioners will be called upon to do because they are under the ethical thumb of the entity that's paying. And I just wondered if you have any feelings.
Well, there's sort of two components to that question. One is the economic aspect of government involved in medicine and where that would ultimately head. And the second is, how does the physician and the patient respond to that? I don't want to get into a huge lecture in economics, but let me just briefly say that there's a very distinct difference between fascism, socialism, and communism. Okay? Fascism, as we know it, began in Italy under Mussolini back in the years after World War I. The word fascist comes from fascisti, or bundle. Everything was bundled together. And the concept there was that we still had private enterprise, but it was run by the government. The government controlled what went on. The next level was socialism. In socialism, we're all familiar about the redistribution of things throughout the economy to each according to his needs, from each according to his ability. And then ultimately moving into communism, which is the abolishment of all private property and the total government control of production. So that's just sort of a brief economic primer. We actually, in my opinion, Medicare, government medicine, is not socialized medicine. It's fascist medicine. In other words, we, as hospitals and private practitioners, have our own businesses, our own practices, but the government tells us how to run it. The government is not actually running the hospitals or the medical practices at this point in this country, but they are over in England with the National Healthcare Service. Now, the beauty about having a fascist system is that the government is to tell you what to do and tell you how to do it, put the regulations in place that you must follow, and yet when things don't work out, they don't get the blame, they just point the finger back at you. So, when the gas prices go up, they don't get the blame for their poor economic policies, they get to haul the oil company executives in front of Congress and demand to explain to America why the prices are so high. So, right now, that's sort of where we are. But if we move into a socialist system, such as the national healthcare system or the Canadian system or all the other systems like that around the world, then things change even further. Then not only is the government telling people what to do, they're actually running the whole show. And that does result in a lot of very, very unfortunate outcomes. I actually have a website called survivingthesuffering.com, and I've addressed that on a couple of articles that I've published there. The title one is What's Your Life Worth Anyway, which deals extensively with the whole euthanasia problem that we see over in Europe. I'll just mention to you that a couple of aspects of that. One is the Liverpool Care Pathway over the National Health Service in England, where if your healthcare providers, your team, decides that you aren't really long in this world, they will withdraw food, water, and other support from you. And it turns out that in an enormous number of cases, the patients and their families are not told this is done. It works out to about 30,000 patients a year are put on the Liverpool Care Pathway without their knowledge. And just this last week, there was a report out of the National Healthcare Service in England where there was a patient who was critically ill, and the healthcare team decided to withdraw support on that patient, and the family did not want to. The family wanted to continue treating their family member, and the courts there decided, I'm sorry, you've lost that right. So that is sort of where you end up moving in a socialized system, and we hope that our physicians will always look out for our best interest, but there are these economic pressures that ultimately take effect. This Liverpool Care Pathway that I'm talking about, healthcare in England is run in what they call trust, which is, like Florida, where we are, there would be the Central Florida Trust, which would be several hospitals in Central Florida. And they pay the trust extra for getting patients on the Liverpool Care Pathway. So it is a very terrifying thing. That's a long answer to your question, I apologize.
That's exactly right on. I mean, I would recall that.
It's somebody else's turn.
Yeah, I had a little confusion. On one hand, the law says that they have to keep the children on until they're 26, but then up here you said the IRS says they no longer have to insure families.
Yes, I'm not sure I can answer that for you. You're right, that is very confusing. The policies that do exist that cover children as they stand now are required by law to cover the children until they're 26. But they're telling the employer they don't have to provide that policy anymore. They can only, the employer does not have to give a family policy. Does that make sense to you? So a family policy,
It's giving with the left and taking you with the right.
a family policy must cover the children until they're 26, but your employer doesn't have to give you a family policy. They don't have to cover you.
Doctor, how long do you think it will be before we have a single payer?
That's the scary question, and that's sort of.
That's where you're headed.
Yeah, I mean, if this system melts down, it depends on who's in charge. Now, if this system melts down, and it's bad enough, and we have free market people in charge, then they'll repeal it and throw it out. If this thing melts down, and it's bad enough, and we have progressives in charge, then they'll just say, well, we just need to go straight to single payer. It's going to depend who's in charge.
Any questions on that side?
This thing's been more trouble.
Okay, in the bill, there's something written about the not-for-profit hospitals, that they're going to be penalized if they give free care to indigents.
I'm not sure I can answer that question exactly. I'm somewhat familiar with what you're talking about. There is something that they were made, I think it's a $50,000 penalty It's not some of the other companies which are millions and millions of dollars. I think it works up to about $50,000 per hospital if you are not documenting that you're providing the care they require.
Just to take our discussion,
Just to take our discussion a little bit further, it seems to me a very convenient way to take that $700 billion out of Medicare in the next 10 years is to do away with a significant end-of-life care, which is a significant portion of the expense of a Medicare patient.
Yes, we know that the vast amount of money that's spent on a Medicare patient is spent in the last year of their life. And there are going to be trends towards that. There will be, they're already talking about requiring end-of-life counseling, talking with you about that. There's going to be a much bigger push towards that, I think. in years to come.
Can we have just one more question? I want the other side. Anybody over there?
Is there an alternative plan that you support?
The question is there an alternative plan that I would support? Quite frankly, the way things are going now, I would be happy to be paid in chickens and eggs like it is back then. It would really work out to be about the same amount. I don't mind telling people what I get paid in regards to it. For I went to college for 4 years, I went to medical school for 4 years. I did 8 years of extended residency training in general surgery, cardiac surgery training. And for me to do a 3-vessel coronary bypass operation, all the staff that I have to support, medical malpractice premiums, and all those things that I have to do with, I get paid to do a 3-vessel coronary bypass about $1,800. A lot of people think, oh, you must get paid $20,000, $30,000, at least $10,000, it's $1,800. And many of you have heard about this new procedure where we're putting valves in with a catheter up through the aorta without opening people's chest. We're the first program in Central Florida to start doing that. It's very advanced technology for people that have no other help. And last time I got paid $650 for doing one of those. So we are under significant price control. What we do is priced well below what it costs us to successfully run practice. I am in favor of anything that moves us towards a free market alternative. I mean, there is just nowhere that constitutionally the government should be running health care. It's just not part of our American heritage. I would, you're asking my personal opinion, I wish government were completely out of it. I would rather deal with private insurance and provide care free for those that can't pay as charity, the way we used to do, than to have the government involved, not only enforcing price controls on us, but making the decisions for us. So anything that could possibly move us in that direction. Now, does that mean that we're going to actually overthrow Medicare and Medicaid along with Obamacare? Or we're going to get really lucky and get rid of all of it? That'll never happen. But anything that would move us in that direction, and probably the only thing that could move us in that direction for the most part would be health savings accounts, where people are putting their own money into it and they have control over what's going on and they get to make the decision about what to do with it.
Thank you.
Thank you very much.
Hopefully you got a lot of your questions answered. After, we're going to break up just a second. Go over and talk to him if there weren't questions. Look at his book, buy his book. He is coming here free of charge. We did not collect anything from you all. The club did not pay him anything, so this is on his own dime. If you're really, really upset with healthcare and you want a relaxing evening, tomorrow night, we're showing Alice Shrugged Part 1. It shows where we're going. It's going to be in the Great Hall, in the Rec Center meeting room at 7 o'clock. So, your excuse, thank.
Chairs. Help with chairs.
Oh, yes, thank you. Each row, I need this, all the chairs in that row stacked at the end. So, me and the
up stacked chairs, and that would help us a lot. Thank you very much. Have a good evening.